Pathological named bodies. So the asteroid bodies, it is seen in the sarcoidosis as well as the sporotrichosis. The halbersteda, provasec bodies. So this is seen in case of the trachoma. And the Miyagawa bodies is seen in the lymphogranular venerum. So these will be memorized on repetition. So then the Leventhal Colli Lilly's bodies, they are seen in the psittacosis. The Leishman-Donovan bodies, they are seen in case of the Kala Azar. The Negri bodies are seen in case of rabies. The Gardneri bodies are seen in case of vaccinia. Then looking at the Bollinger bodies. Bollinger bodies are seen in the fowl pox. The Henderson-Patterson bodies are seen in case of the molluscum contagiosum. Then looking at the Cowdery type A. The type A is associated with the yellow fever as well as a herpes virus infection. The type B, if you see, it is associated with the adenovirus as well as a poliovirus. Now moving ahead, the Russell bodies are seen in case of the multiple myeloma, and then the Ashcroft bodies, they are seen in case of the rheumatoid fever. The Karl-Exner bodies are seen in case of the granulosa cells of the ovary. Then the Kivette, that is colloid bodies, are seen in case of the lichen planus. Then the Michaelis-Guttman bodies, they are seen in case of the Malakoplakia M and M. Then the Levi bodies are seen in case of the Parkinson's disease. The Pappenheimer cells, they are present in the non-heme iron pigments in the siderocytes. The Hedge bodies, the Holy Jolly bodies, they are present in case of the splenectomy, the megaloblastic anemia as well as the hemolytic anemia. Next we look at the Haynes bodies. Haynes bodies, they cause a G6PD deficiency. Then comes the gamma grandy bodies, they are suggestive of the congestive splenomegaly. Next, the Mallory bodies, they are present in case of the hyaline inclusions, that is in case of the hepatocytes as seen in case of alcoholic cirrhosis as well as in case of the Indian childhood cirrhosis. Then we look at the Councilman bodies, they are seen in case of the hepatocytes undergoing the apoptosis, and it's seen mainly in case of the acute viral hepatitis. Then Samoma bodies, they are seen in case of the dystrophic calcification, in case of the meningioma, the papillary serous cystadenoma of the ovary as well as a PCT hybrid, and the papillary type of the renal cell carcinoma, the PCT thyroid, and the papillary carcinoma thyroid and the papillary type of the renal cell carcinoma. Next, in case of the Donovan bodies, they are seen in case of the granuloma inguine. The Nissel's bodies, they are seen in the cytoplasmic inclusions of the neurons. The Musa bodies, they are seen in the typhus fever. The Criolla bodies, they are seen in case of asthma. Verroque bodies, they are seen in case of schwannoma. Then the Schiller-Duval bodies, they are in the endodermal sinus tumors. Then comes the Hirano bodies. Hirano bodies are seen in case of the Alzheimer's disease. Then the furogenous bodies. The furogenous bodies are present in case of the asbestos.